Good evening and welcome to our webinar for How You Diet on immune supports or immune system support. We're glad that you've been able to join us this evening, and we'll have Dr. Donaldson with us. And we know that he has done a lot of research and really put together a great presentation as well as a protocol, as so many people and so many of us are worried about the current environment with COVID-19 running around. But before we get into that, we really appreciate you taking the time to join us. And I'm Paul Malcolmus, president of How You Diet. And before we get started, I would like to just ask the Lord to bless our time this evening. So let's pray. Dear Lord, we just thank you for this opportunity to present this information. And we know this is a real difficult time for many, as they're scared and they're looking for solutions. And we know that you created a miraculous body, Lord, that is really able to not just be in health, but also to regain health. And we know that we need to give it the things to help fight these types of viruses off, and we need to keep a strong immune system. And we know that you gave us answers. And Lord, we just pray that we're able to convey some of the things that you've shared with Dr. Donaldson, and that even in this time of uncertainty, Lord, that people will have peace knowing that really you are in control. Pray that you'll bless Dr. Donaldson as he presents this evening, and that we honor you through this. In Jesus' name we pray. Amen. Well, and Dr. Donaldson has been with How You Diet since 1998, and he's our lead researcher and scientist, and he's done an incredible job of not just doing validation of the How You Diet and guiding us from a nutritional and dietary standpoint, but also in researching and helping to not just define products, but find delivery systems and products that really are as effective as any in the world. But he's also looked at things like the studies on how these different supplements really impact the immune system and the parts of health that we're really trying to impact. And so it's a real honor to have Dr. Donaldson with us this evening. And if you have any questions throughout the presentation, feel free to plug them in there on the app, and we'll do our best to answer all the questions that you have. So, Dr. Donaldson, thank you so much for joining us this evening.
Thank you very much, Paul. Glad to be here tonight. And really, we thank you all for taking time to be with us tonight as well. Whether you're listening to this live or you're listening to it later, thank you for joining in. We've been teaching people how to support their immune system now for more than 25 years, Paul. So this is a new thing to some people, but it's not that new to a lot of us here. So we are still glad to be part of this here. This is for such a time as this, very much, because we are ready for this, and we will help you be prepared too. So we want to go over just a couple things. Maybe we get a lot of you know a lot of kind of what the COVID problem is right now. And globally, this is a new virus that we haven't seen before. It's a little bit different. So everyone's kind of concerned about that. It's a coronavirus. We know something about coronaviruses in general, though. So it's of that family of viruses there. So it's very infectious. It's not as infectious as measles, but it does carry faster than other flu viruses. And the real danger is that your body doesn't kick it out, and you end up with pneumonia. And that's the real trouble with it. So of course, you know, it's all over the place now. The numbers keep changing. So now there's over 700,000 cases. I think it's getting close to 1 million cases in the next couple of days worldwide. You know, China, Italy, Iran, Spain, those countries, and the U.S. is coming as far as countries that have been really hard hit by this so far. A lot of deaths, approaching 35,000 deaths worldwide with this. In the grand scheme of things, that's not a lot of deaths per across the globe, but it seems like a lot from one thing all at once here. In the U.S., with our limited testing, we found 150,000 cases or more. That's approaching 200,000 cases, and it's approaching 3,000 deaths here as well. Washington State was the first place they found that. I'm broadcasting from Washington State, kind of on the other side of the state, but we've had a lot of it in the news around here, as well as New York City. Just for some perspective on some of this, we've had 195 deaths now in Washington. 31% of the cases are for people older than age 70, and they account for most of the deaths. And you have 30% of the cases from ages 40 to 60, and very few of these people are dying here. And here's a graph of what that looks like in Washington. The numbers, keep changing, but the general trend is what you can see here. The older people are not the only ones getting sick here. All kinds of people are getting sick from ages 20 on up. But the people that are really high risk are the people that are older, ages 70, 80, and on up from that. And so that's where the real risk is at. So if you find yourself in that category tonight, pay attention. And here, this is something very interesting I found yesterday from New York City here. They looked at the cases and broke them up by those who had underlying conditions and those that didn't have underlying conditions. At the bottom of that table, it says a total of 704 people that are cases that have died of the COVID-19 with underlying cases, and 14 that didn't have underlying conditions. Those conditions include diabetes, lung disease, cancer, immunodeficiency, heart disease, hypertension, asthma, kidney disease, and GI or liver disease. So if you have one of those situations going into this, you're at higher risk. So if that's where you are tonight, pay attention. Pay careful attention if that's where your loved ones are at. If they have some of these conditions, if your loved ones have diabetes, you should pay attention. If they have high blood pressure, you really need to pay attention because you're the ones that are at risks here. So they tell us to stay away from each other. The social distancing, I think that's going to be the new word for 2020. Never really heard that word before, but that's all you hear now. And they give you some very simple advice, and it's good advice, but that's it? Is that all we can do? It makes you feel like you're just helpless, waiting for the Grim Reaper to show up, and you just kind of wringing your hands and hoping against hope that you don't catch it. But we're here at Hallelujah Diet. We're here to tell you there's a lot more you can do. We are prepared for such a time as this, and we want you to be prepared as well. Because there really is no vaccine, there's no treatment that's really effective at this point. Maybe the hydroxychloroquine is going to work. FDA has kind of given it provisional approval. So by the time you hear this, maybe it's good, maybe it's really going to work, but maybe not. Your best chance is for your own immune system to respond, to kick the virus out and get rid of it. So you need to know what you need to control an infection, what gets depleted when you get an infection as well. So you can replenish what your body's using up a lot of. So there isn't a silver bullet, like one magic supplement you can take and everything's going to be okay. The best approach is the one that uses several supplements, several nutrients working together. It's a network together. It's teamwork. All these things work together. It's vitamin C, silver biotics. There's some silver in here, actually. Vitamin D, selenium, and other nutrients that help boost glutathione levels in the cells, and iodine. And the form of each nutrient and the way it's delivered to you can be critical. It can be life-saving in some cases. So let's go through these. Let me tell you why each of these are included in here. Vitamin C, as you know, that comes in fruits and vegetables. Berries, strawberries, great source. Melons, vitamin C, citrus things. But in a case like this, you may need a little bit more. The power of vitamin C has been tested for a long time. Dr. Frederick Clinton, back in North Carolina in the 40s, was curing viral infections with intravenous vitamin C. Was said that as he was taking a medical history, sometimes he knew someone was in bad shape, and he'd start giving them vitamin C right away before he figured out what was wrong with them, because it was going to help. He had enough experience knowing that this is what this person needs. So he did 60 consecutive polio cases, and each one of them got better, free of their symptoms. You name it, and he reversed it. Measles, mumps, pneumonia, chickenpox, spider bites, whatever. It all responded. All these toxins responded to vitamin C. So he even reported on viral pneumonia, which is what people are dealing with now, back in 1948. So a long time ago. This has been around a long time, and it has been tried recently as well. There's some connections with the doctors I think they've worked in the U.S. and gone back into China, and they've been doing clinical trials of intravenous vitamin C right in Wuhan, China. I don't know if you heard about that or not, but they were doing that. 10 grams a day for moderate cases, 20 grams a day for severe cases. So Dr. Enquian Mao, he's the director of emergency medicine, this hospital in Shanghai, is a place where they've treated a lot of COVID patients. They treated 50 patients in their protocol with the intravenous vitamin C. They all got better. Nobody died. There's no side effects. They didn't stay in the hospital as long, 3 to 5 days less time in the hospital. Great, good treatment. And wish they could get the word out further that it works for more people here. So there is a major vitamin C manufacturing plant in Jingshan, China for DSM. Maybe that's why you didn't get all your vitamin C, is because 50 tons of it went to Wuhan back in towards the end of February. And they stood with him, and I don't know what all happened to that vitamin C, but I think it probably literally made tons of difference to the people down there. So as they got the word out that vitamin C was working, I think they gave it to a lot of people. So I would love to hear the story, the rest of the story, coming out from that. Maybe we'll get to hear that. I hope so someday, and see what really happened to all that vitamin C there. Well, as Paul mentioned, the form of the delivery here is important here. Some forms work better than others. Vitamin C, it's all good, but some forms are better than others. So we sell and promote liposomal vitamin C because it delivers vitamin C to the cells at a much higher rate. It's much better absorbed into the blood, into the cells, because of the form there. And you can go back here, the story of Alan Smith. He had swine flu back in 2009, and a news station did a story of his recovery and the process through there, talking with the family of Alan Smith there. And he was left to die in the hospital pretty much, no chance of survival. They took a X-ray of his lungs, just white out. There's no breathing going on in there. Family convinced the doctor to let them try intravenous vitamin C. And he made some recoveries, start to recover and was able to breathe. They transferred him to another hospital for some reason, and that hospital would not allow them to use intravenous vitamin C. They turned to liposomal vitamin C as an alternative to that, and he was supposed to be in there for like 30 days, and about a week or 2 weeks he was out of there. He was done, made a remarkable recovery. So that's the power of liposomal vitamin C. And you might be familiar with what liposomes are. Let me just go over it real briefly here. The phospholipids have a little tail that doesn't like to be in the water. It likes to be an oil layer, and a little head part that likes to be in water. So it self-assembles into a sheet, like the top and bottom, in layers like that, in an aqueous solution. When you add a lot of energy to that, you can form these little balls, not just little micelles, but the liposomes. They have a little pocket on the inside of them that carries whatever was in the large medium. So you have a solution of vitamin C with phospholipids in it. You add a lot of energy through ultrasonic, something like that, ultrasonic energy, or against a plate, different ways of making the right size liposomes. And you end up encapsulating vitamin C inside here, and it delivers into the cells just as a little fat globule. So it works very well. Well, how's that compared to intravenous vitamin C? Dr. Thomas Levy, he wrote a book on vitamin C and toxins. He said he's used them both. He says, I proved to my satisfaction that 5 or 6 grams of properly encapsulated liposomal vitamin C taken orally had a greater clinical impact than a 50-gram infusion. And he gave a case report of a 15-year-old Colombian girl with hemorrhagic dengue fever. They gave her 10 grams of vitamin C. She recovered within a day. So he's seen it work, and it works fairly effectively. So if you can get your hands on liposomal vitamin C, we've looked at ours, we've checked, it is properly encapsulated liposomal vitamin C. So that's what we're selling to you as well. If you can't get IV vitamin C or liposomal vitamin C, there's still, if you can get your hands on vitamin C, it's going to help you quite a bit. Any form of it will work. Just take 2 grams of it every hour, top of the hour, and through the night, if you're not sleeping well, wake up, get some vitamin C. If you can do nothing else, even that will help you. You want to work up to bowel tolerance, and that just means you're taking enough vitamin C that your system's kind of saturated in your GI tract, and it gets to the point of diarrhea. And at that point, you need to back off just a little bit and keep going. Don't quit. Just back off a little bit and keep taking the vitamin C. That's what you're headed with that. That's just one member of our team. That in itself is very powerful, but there's more. Silver biotics. Silver biotics has been used also. This is, there's a lot of colloidal silvers out there. Silver biotics is a bit unique because it's not ionized silver, the way you'd make in a little colloidal silver generator at home. Put an electric current through, with a little piece of silver on one side and put in a current through it. This is different. These are actually particles of silver, metallic silver, and has silver oxide surrounding the inner atom of silver. And very specific size of the particles, and it's only about 10 parts per million. So it's not really concentrated, but it has a resonant frequency in there that really helps it work very well. And they have data to prove their claims. You have claims on defeating bacteria. They've used it with people that had malaria, clear up quite nicely. They've shown that you spray it on surfaces, and you get several logs worth of fewer bacteria if you wait long enough. It does take a little while. They've shown that it works against viruses as well. Even purifies your water. You put it in your water, you wait a bit, and your water gets clear as well. So not only is it a colloidal silver, but this particular form has been validated. It works well. So we're excited to work with them on that. And because of advertising, they can't say exactly how it works. They can tell you, well, this boosts your immune system. And they're not selling it to kill viruses. They're selling it to support your immune system. And that's the way we're using it. We're supporting your immune system. So your immune system has what it needs to counteract a strong attack. They also make a gel. Makes a good hand sanitizer. It's great to put on wounds, but it's for hand sanitizer as well. They say it can last 4 hours even with hand washing. You can put some in your nebulizer, and we'll talk more about that towards the end of this talk. But you can put that in there to help boost lung function and immunity as well. So that's the silver. Great results there. You go back and read the patents. They are available. Look up those numbers, and you can read all the good things they have done and proven with this. Vitamin D, this is one of our go-tos for a lot of things because it has such an impact on so many different systems of the body. Well, vitamin D is for helping increase absorption of calcium. And it is, but it's a lot more than that. See, the immune system takes the storage form of vitamin D and converts it into the active form of vitamin D. They have that enzyme that does that in different parts of the immune system. It's in the epithelial cells, in the lungs, and the airways. White blood cells have it. Macrophages also have the ability to activate vitamin D. This activation of vitamin D leads to the production of antimicrobial peptides, one of which is called cathelicidin. So cathelicidin is actually, it's generic. It kills lots of kind of bacteria, and it will disrupt the envelope membrane around a lot of viruses as well. So it's a generic antimicrobial peptide that your body makes. So your immune system was designed to take care of a lot of things if you provide it what it needs. Vitamin D also modulates another pathway called the NLRP3 inflammasome response. This response, it's a bit complicated. I hadn't heard of it until doing research lately on this. This inflammasome response is designed to quickly clear out bacterial and viral infections by a method called pyropaptosis. Pyro is like fire, right? So this is an inflammatory cell death pathway here. So I guess you get compromised cells that have taken up a lot of viruses, and the body destroys that with cytokines. So that's some of the mechanisms of vitamin D. Now, vitamin D has been tested against influenza quite a few times and different respiratory tract infections. In fact, here, I don't really expect you to read all these. There's 26 studies that were reviewed here, and the authors actually took the individual data here. They didn't just lump the studies together. They took data from each person and put those together in these studies here. Most of these studies use fairly low levels of vitamin D, but altogether there's about 11,000 subjects here in these 26 studies. They use low doses, 400 to 1,000 IUs. That's really not enough to make much difference, I would think. And even then, they found a 12% reduction for when you looked at all 11,000 subjects here. When they dug into the data and looked at it a little bit more closely, they said, well, okay, there seems to be a difference between those who get it daily or weekly, or ones that just get a bolus of vitamin D, like once a month or just once a season, something like that. When you just gave it once like that and a huge dose of it, it really didn't work. All the good effects were really when you gave it on a daily basis or at least a weekly basis, 19% reduction. If you started a study here of these 26 studies and you were truly deficient in vitamin D, you had a 70% reduction in risk of acute respiratory tract infection during the course of the study here using vitamin D. So good news, if you're low in vitamin D, you can start now and you can build up your level of vitamin D starting now. You don't have to wait, and it'd be a good idea to start. The key on this slide is modulation. There's been some discussion about, well, vitamin D shouldn't be used because it increases the amount of cytokine interleukin 1 beta. And this cytokine is inflammatory. And it's true in some cases vitamin D does produce more of this. Well, that's necessary to produce these antimicrobial and antiviral peptides. You need some of that response there. But it also keeps you from going too much as well. It prevents overexpression of those cytokines. It gives you some response without going crazy. And so that will help prevent a cytokine storm happening, which would lead to viral pneumonia. So modulation, it's okay to have high amounts of vitamin D because it's going to modulate. It's going to bring it to a good level, not too much, not too little. So that's our third supplement here. We'll look at selenium a little bit here too. Some of this research on selenium is very interesting here. Selenium has been related to antiviral effects for quite a while now. Part of it is through antioxidant mechanisms. Selenium is part of the protein glutathione peroxidase. It's actually an enzyme which goes around and it's involved in breaking down hydrogen peroxide in the body and free radicals. If I got that right here. Anti-clotting activity as well is seen with selenium. People with COVID-19, it's been reported that there is hypercoagulation of the blood going on, and selenium may be helpful in that particular case as well. Now, you take a look at this map. When I saw this map, it was like a light bulb went on. The yellow areas here are areas that are deficient, and the soil was actually low in selenium. All these areas here, and this is where some of these viruses start. All right, the H2N2 flu, H3N2 flu, H5N1, SARS virus, the SARS coronavirus previously in 2006, I think it was. The Ebola Uganda virus, the Ebola Zaire virus start in areas that are low in selenium, as well as HIV. The gray spots there, in case you're wondering, those are areas that are low in iodine as well. You mix those two together, and that's really bad. But here, over in China, in the area of Wuhan, is actually deficient in selenium in the soil. So if they're eating produce and eating animals fed local feeds that are deficient in selenium, well, they're going to be deficient in selenium too. So here, this review here about micronutrient selenium deficiency, this was written in 2011. It reads like prophecy in some ways. These different viral infectious diseases that have emerged, things like AIDS, H5N1, the 2009 H1N1, SARS, Ebola viruses, these cause metabolic oxidative stress in hosts deficient in antioxidant selenium and induces both impaired human host immunocompetence and rapidly mutated benign variants of RNA viruses to virulence. All right, well, that's a mouthful. So what he's saying is that people very low in selenium are easily infected, and then the virus mutates into a stronger strain in them. Okay? We go on to the abstract. I'm not going to read all that he says. I'm going to give you the translation of this, of what he's saying here. So you get a virus, it infects someone that's deficient in selenium. It easily mutates in that person because they don't have selenium to slow it down. That mutated virus can then infect people that have sufficient levels of selenium. It becomes a more virulent virus, more infectious. If you give people that are low in selenium more selenium, they will have stronger immunity, and the virus will stop mutating in them and will stop getting stronger. So there in China, you get people that are very susceptible to the virus initially, and then it mutates into more virulent forms. It becomes more deadly for the rest of us, whereas if you are selenium sufficient, exposed to the initial virus, it may not have affected you very much. But that's not what they got. They got people that were deficient in selenium. The virus mutates, becomes stronger, and then spreads to everyone else as well. So now we have a problem. So the end of it, there's the end of his abstract on this from 2011. And really what it comes down to is we could have prevented this by fertilizing farms in China with selenium. If the people were eating foods that had selenium in them, in America, a lot of the animal feeds are actually supplemented with selenium as well. And some of the soils have added selenium to them because it's important. It's been recognized for a long time now. So selenium is part of many animal feeds as well. And that's why those viruses, one reason I think why viruses don't start like that over here. So what does selenium do for people here? Here's a study looking at 25 HIV-infected people in Miami. They followed them. They looked at these factors to see what was most important for predicting survival. And they found antiviral treatment was not a factor for survival. And all these other things did affect survival, but the most important thing actually was selenium. If you had low selenium, you had a 10-fold higher risk of dying of HIV. If you had high levels of selenium, you're much more likely to survive. So that was the most important thing. You say, well, what about zinc? Wasn't that important? Well, it did help, but selenium was more important. So if you focus on zinc, you might forget the selenium, and the good is getting in the way of the best. So that's why we're focusing on selenium here and not zinc. Again, another study done with HIV-infected people in Miami, they gave them selenium as selenial yeast, about 200 micrograms a day, over 9 months, and then they looked to see after 9 months what was going on. They found the selenium supplement did help lower the viral load of HIV, improve their CD4 counts, and the ones that actually took it, some people didn't actually follow through with it, but those that actually took the selenium had the best improvement here. So it's not necessarily saying that selenium is going to kill the disease and it's going to knock it right out, but it is going to improve your immunity. So you want to make sure you have sufficient selenium. And if you're under attack, you want to have that on board. This has been done in China some years ago, where they had hemorrhagic fever, and that's just where you're bleeding. You're bleeding out from the inside. And they gave people 2,000 micrograms of sodium selenite orally, and mortality decreased significantly. For the really bad cases, instead of everyone dying, just 36% of the people dying. In severe cases, from 22% mortality down to 0. And they said it might have worked even better if they had used injectable selenium. But even like that, that's pretty good results there. So our selenium product that we've put together also has nutrients in there that help promote the increased level of glutathione in the body as well. Turns out you can't supplement glutathione by itself very well, because it's just 3 amino acids together, the glutamine, glycine, and cysteine together there. That's glutathione. But glutathione is very important in the body. Inside the cells, it's involved in detoxification in the liver. It helps reduce inflammation, and it helps take care of free radicals. So glutathione is the interaction of all 3 of those things together there. So during infections, there is a lot of oxidation going on, a lot of oxidative damage in cells. And glutathione helps balance that whole network of antioxidants and helps balance out the oxidation and reduction within cells. So it's important as your antioxidants are being depleted during an infection that you supply what your body needs. You don't want to add just vitamin C because your body runs on a lot more than just vitamin C. You need glutathione and other antioxidants as well. So you need to supplement with some things that help boost levels of glutathione. The limiting factor really is cysteine. It's really hard to take cysteine and get it into the body because it's not water soluble. The polar molecule N-acetylcysteine works a lot better, and that's what you find in our supplement, and that's what you find in many supplements. Alpha-L-lipoic acid also boosts the levels of glutathione, so that's included as well because that goes together. And it turns out selenium itself also increases levels of glutathione. So those 3 things together are in the supplement that we call glutathione promoter selenium. So we have one more product to talk about here, and this is iodine. Nascent iodine in particular. Iodine is special because it's in the same periodic family as chlorine and bromine. So it has germicidal properties, just the way that chlorine does. And chlorine, of course, is where we get bleach from. But you can't just, you can clean surfaces with bleach, but you can't drink bleach because it's just way too oxidative. It really damages you. So don't do it, okay? Bad idea. But you can use iodine in small amounts, and is effective in the body for having the same sort of bleach properties that chlorinated compounds have. So it can be used. Surgeons, I don't know if they still wash with that iodized soap or not. That yellow soap, it had a particular smell to it, and I think they still do. And then use a betadine to clean skin before they did surgery as well, just to help get rid of the germs right on the surface of the body. So its properties against all kinds of microbes is well known. Nascent iodine is a special form of electrically charged iodine. It's more bioavailable than just regular I2 iodine. It has better results with less iodine as well. So you put this I2 regular iodine in an electromagnetic field, and there's some process in there. To me, it's kind of a black box. I don't understand how it's made. But you end up with singlet iodine, nascent iodine. And it doesn't have anything added to it. It's just iodine in an alcohol solution. Well, how do you know it works? It's been tried. So over in Africa, there was a clinical trial using the same nascent iodine that we sell with malaria. And they would give these, it was at 10 drops in about 100 mils of water every 4 hours. So it wasn't just a one-time dose. Every 4 hours, they got these 10 drops of iodine, of the nascent iodine. And after a week, they found, 91% cure rate in men, 78% in women, and 77% among children. Most of them responded. And this is just using one part of the team. If you did everything together, that would be way better. But even so, using nascent iodine, you see the power of this to really defeat something that, malaria, horrible thing. It holds whole countries captive still. So it works well, and it's part of our team of things that you can do to support your immune system. Now, earlier I talked about a nebulizer a little bit, because this is a powerful way of delivering some of these supplements, some of these nutrients into your body here. Nebulizer here, it has a compressor, has a tube and a mask or mouthpiece, and a cup for holding a little bit of liquid medicine. And you turn on the compressor, and it sends a flow of air through there, and it atomizes the medicine, and it creates just like a cool fog, vapor there, an aerosol of the medicine, and you breathe it right into your lungs. So from there, it can go systemically, but especially it gets right to your lungs. And when you have a respiratory tract infection, that's exactly where you want this stuff. So nebulizers are typically used for children or people with asthma. They use albuterol is a medicine typically used for that. You could use magnesium chloride instead of that, because that would actually help relax the bronchial tube. But in this case, there's some things you could do with this. And you just look around you and see what you've got. Silver biotics, up to 5 mils in a session, works great. You could do that, every hour. You could do that several times a day even with that. Nascent iodine, you start very, very low amounts, just a few drops in a teaspoon of water. That's a good place to start with that. Don't use Lugol's iodine, because it has more potassium in it. You don't want to be adding potassium and throwing balance off of potassium. Use nascent iodine for that. You can even use hydrogen peroxide. That's very common. That's easy to find. It'd be best to find food grade hydrogen peroxide, but if you can only find the first aid grade, that will still work. And you can use vitamin C. So depending on what you have available to you, you can use different things, and all of these will have an effect on respiratory tract infection. Will give your immune system quite a boost here. Here's one man who does, Dr. Schallenberger. He does work with IV hydrogen peroxide IVs, vitamin C IVs. He had this to say: when my wife developed first signs of flu, Instead of immediately plugging her into a hydrogen peroxide IV, I had her use a nebulizer for 10 minutes every waking hour. Using the nebulizer treatment, she was able to get rid of the fluid within 72 hours. I knew I was onto something because IV hydrogen peroxide doesn't work much better than that. So I bought a dozen nebulizers and began offering the treatment to my patients here. So there's one doctor who found good results with that. Dr. Thomas Levy, who I mentioned earlier, said this: I can only say that I have seen the protocol promptly eradicate acute viral infections. It also promptly relieved nonspecific dry coughing spells. And most significantly for me, it has largely resolved over a 4 or 6 week treatment period a chronic sinusitis and nagging cough of roughly 60 years duration. For me, it has been nothing short of a minor miracle, because he's used vitamin C for many years, Thomas Levy. He wrote the book on it. But it wasn't getting to where he really needed it. When he used a nebulizer, then he used some hydrogen peroxide, and he also used that mix of vitamin C, magnesium, and DMSO as well. So he had a couple of different things in there. But it works very effectively. So that's our team. That's, if you get your hands on a nebulizer, that can make a big difference as well. That can deliver your natural immune boosting supplements to where you really want them. So let's talk about putting this all together here, because it requires teamwork. You could work with just one and it might work. You could take a lot of vitamin D, or you could take just a lot of vitamin C, or you could use just the silver. But if you do these things together, the chances of you having a good outcome go up dramatically. So I would advise you don't rely on one single thing here. Get multiple things working together, and you'll get better fast, because you're supplying all the things that are getting depleted. So take your vitamin D and selenium supplement with food. However you worked it out, that's fine. The vitamin C and silver biotics can be taken together. Just don't take them with food. Wait a little while. And the Nascent iodine, it's best to do that on an empty stomach. Just let it absorb quickly into the body, and do it before you take the vitamin C and the silver. So the way this looks like is like this. So in the morning, when you wake up, put 10 drops of Nascent iodine and about 3 ounces of pure water. 15 minutes or half an hour later, get the liposomal vitamin C and a teaspoon of silver biotics. 1 or 2 grams of liposomal C, a teaspoon of silver biotics, and then wait a little while before consuming any solid food. If you're going to get a smoothie or juice or something, that'll be okay there. And then every 4 hours through the day, keep repeating the iodine and then the vitamin C and silver biotics together. And you can end up with 6 doses doing that: before breakfast, before a lunch meal, before evening meal, before going to bed at night, and twice more during the night if you need it. If you're waking up feeling lousy, 8 hours is a long time to be without your supplements. So I'd go ahead and take them again. The selenium you can divide into doses with food, so take a couple capsules at each meal, and up to 1,000 micrograms is okay for a few weeks. You don't want to take that much long term, but for a few weeks it's fine. Take your vitamin D with food that has oil or fat in it. You don't have to spread that out. Just take it once. Take the meal that you have that has the most oil or fat in it. Take it then. You can take 150,000 IUs for 3 days in a row. Now that sounds like a lot, and it is a lot. There's been about 4 different clinical trials now done with critically ill patients in hospitals, some of them on mechanical ventilators. These are really sick people, and they would give them this level of vitamin D, 250,000 to 500,000 IUs in a very short time, like within 5 days. And they did very well. No problems with toxicity, and they got better results. So, that's a good idea. Take 150,000 IUs for 3 days in a row. And then after that, once the fever is broken, you can slow down, but don't quit. Keep taking vitamin C, keep taking the iodine, the silver biotics, and the selenium and the vitamin D, just at lower doses. So, when you're looking at this, well, this is a lot to do. Who needs this? If you're thinking that you're going to get exposed to a virus, it's a good thing to do. And they keep telling us with the COVID-19, it's not really a matter of if you'll be exposed, but when. It's just a matter of time. They're trying to slow down the spread, but they're not saying they're going to prevent it from spreading. It's just going to slow it down. So you need to be prepared for when you face this virus. So get your supplies now if you still have time. We have time. We have immune system kits in stock to help you out. You can go local. You can find what you can find for vitamin D and vitamin C. Those are fairly easy to find. And get ready, because you want your body to be in good shape before you get there. You want to have the nutrition you need as well. After vegetable juice, fresh vegetable juice, Barley Max is one of the best things you can take, because for supporting cell health, for boosting the immune system, for getting all those trace minerals that you need. So that's part of our Ultra Immune Kit as well. To get the Barley Max in there, that's a great way to help your immune system. Because a strong infection requires a strong immune defense. Right? If you don't supply your body with what you need, you don't make it through very well. This is a summary of all of this together. I won't go through it all again. I would urge you to take a screenshot of this right here. Just take a screenshot now, so you can have that when you need it. And it puts it all together on one page, so you can print that out. You have it available. Figure out, well, how do I do this? The iodine, how does that fit in? Take it by itself. Take the vitamin C and silver biotics together. And you don't have to do that every hour if you're taking the liposomal vitamin C. Just take that, every 4 hours, and that will work really good. You can take more vitamin C if you want with it. There's nothing wrong with that, but it may not be necessary. So take those together. That's the idea there. I want to thank you for your attention, for listening. It's a lot to take in at once, so you may want to go back over this, read it again, listen to it, and get ready, because we are prepared for such a time as this. So thank you for listening.
Thank you, Dr. Donaldson. That's great information and a great explanation on how the different supplements help to support the immune system when it's under target. As you can imagine, we have quite a number of questions. I guess if we could start with vitamin D, because typically we want to take D with K2, D3 with K2, and the protocol calls for D without the K2. Can you kind of explain when we want the K2 and when we really don't want the K2?
For a few days, if you're trying to get 150,000 IUs of vitamin D, if you're using our supplement, that's more vitamin K than you really need, or would possibly even be good for you. It's more than anyone else has used before, put it that way, because you'd be using so much. So if someone's starting out really deficient in vitamin D, using that D3 and K2 combination is probably not a good idea. And taking 30 capsules, it's hard to do. So that's part of it as well. Take the D3, 50,000 IUs, that's part of the kit there, to help through a time like this. If you're already taking a lot of vitamin D, you don't need to add on a whole bunch at once. Keep taking the D3K2. But if you think you've been lax in taking vitamin D through the winter here and your levels are low, or someone that hasn't been taking any vitamin D at all, you can get them up to speed safely with the 50,000 IU capsule.
Okay,
does that make sense?
Great, and it does. And if somebody has kidney damage, is a high dose of vitamin D detrimental to them?
Possibly. You'd want to work with a doctor on that if you do have kidney disease for high levels of vitamin D. That is one of the counterindications if your kidneys aren't working well, because it does put more pressure on the kidney, because then it has to start doing that transformation into the active form.
Makes sense. And then on an ongoing basis, how much selenium should somebody take, and does that change with a therapeutic level?
Yeah, 200 micrograms a day is a good level. Between 200 and 400, that'd be like 1 to 2 capsules of the glutathione promoter on a daily basis. That's a good level.
Okay, great. If somebody's allergic to iodine, Is there an alternative, or just drop it out of the protocol?
I would just drop it out. If you're allergic to it, don't make matters worse.
Just trying to go through. Somebody asked about a copy of the slides, and this is being recorded, and we'll send out a recording notice within a couple of days. And as well, we'll put in the JPEG or a picture of the protocol that when Dr. Donaldson suggested taking pictures. For those that weren't able to do that, we'll have that in an email coming out here in the next couple of days. You answered a lot of questions as we went through them, so I've sent a link to the nebulizer where they just got them back in stock. So those that asked about where to buy a nebulizer. So Dr. Donaldson, speaking of nebulizer, would you use any saline solution or anything additional, or would you just put the silver biotics with some C and some iodine in the nebulizer as it is?
Yeah. In my nebulizer, I just put like between half a teaspoon and 1 teaspoon of the silver biotics, and that was about the right amount for that one there. So I didn't add any more liquid to it. If you're using iodine, I wouldn't put all 3 of those things together at the same time. But if you're using iodine, you have that, just a few drops in about half a mil to 1 mil of water, pure water there.
Okay, just pure water, distilled water or something like that.
Right, and that would work. It's going to make a mist, and you don't have to have a saline solution for that to work well.
Okay, that's good to know. How do probiotics work into this type of protocol if somebody's taking probiotics?
You would take that. I would take it the way you're normally taking them, and that's gonna long term. That's gonna help your immune system with the probiotics, because a lot of your immune system is in the gut as well. But here, some of these supplements are really to help your respiratory tract as well, not just the gut. So that's the oral health probiotic might be beneficial there, because you could chew that up, and that's going to put some beneficial bacteria right in the nasal cavity, but up in the upper part of your respiratory tract there.
Okay.
There's a lot of things you could do, and there's no end to that. You could take this and that. You could take biotics. That helps with flus and things too. And you could, a lot of things will help, but you have to kind of cut the line up someplace where you kind of stop. In a sense. But if you're taking these things, they are going to help your immune system.
If somebody's on blood thinner, would taking the selenium be of any harm?
I don't know of any interaction between selenium and blood thinner. Vitamin K, yes, but not selenium. A little bit different mechanism, I think, in there. Again, if you're taking prescription medicine, it's good to talk with the one who gave the prescription about interactions, if they know of any interactions with different supplements or things like selenium as well.
And you talked good about silver biotics, and there's some health professionals that sometimes speak negatively of silver solution. Can you touch briefly on the difference between most silver solutions and the silver biotics?
Silver biotics is a metallic silver instead of ionized silver. What you make in a little colloidal silver generator is mostly ionized silver. And that's the kind of stuff you keep taking on a regular basis. That's the kind of stuff that can actually make you blue. Okay, there are gyro. Silver biotics actually doesn't turn anybody blue. So it has a much different safety tolerance to it. they measure that, and there's an issue with that. It comes in, it stays in the body, but it also goes out. It doesn't accumulate in any organs in the body, so it's safe that way. You can use it, and it's not going to have negative effects like other forms of colloidal silver.
Mm-hmm.
So that's one of the biggest differences there. And they have data to prove that their type actually works.
Okay. And I think we have a little bit of an audio problem with you, Dr. Donaldson, but we're able to make out what you said, but we do have a little bit of issue there. If somebody's on prescription meds like asthma medicine, any negative with taking the supplements and using a nebulizer that way?
I think that if you have asthma, this is more critical for you to be on your P's and Q's and be careful here, because the virus is going to make, complications with asthma are going to get worse.
Mm-hmm.
So
it's even more important. It's even more important to be doing this.
It's more important to take the supplement and get into as good shape as you can before you get that.
Mm-hmm.
And I'm not talking about a lot of exercise. I mean, get your diet in order.
Yeah.
And kick the sugar out, kick the refined foods out, and start eating a lot more salad. Make your smoothies, and get on a plant-based diet. Get on the healthy diet quickly here, so that you're ready for this.
Mm-hmm. Well, I think we've really covered through a lot of the questions on Dr. Donaldson, and if we didn't get your question answered, email your question to custserv, CUSTSERV at myhdiet.com, and we'll forward those on to Dr. Donaldson and try to do our best to get all the questions answered. We know this is a timely subject, and there's a lot of concerns, and we're just thankful that you joined us this evening, and we pray that something that we've shared here will help you and improve your health and the health of your loved ones. Dr. Donaldson, thank you so much for joining us this evening, and we really appreciate the information that you put together here.
All right. Thank you all for listening.
And thank you, everyone. And we'll be back next month next month in April. We have a webinar scheduled toward the middle of the month. And until then, please stay in health, be safe, and we continue to pray for our leadership and government and to give them wisdom as they try to give us guidance on how to best stay protected. Until next month, God bless.